Okay, so do we have any public comment on items not on the agenda? All right, seeing none, our first presenter is Adrienne Beck.
Good morning, Commissioners. So what you have before you is the MOU lease agreement for our non-congregate shelter that is a facility currently owned by the City of Missoula. The intention here is to enter into this lease agreement for the purposes of non-congregate sheltering through our non-congregate sheltering plan that has been approved by the state of Montana and FEMA. What this will enable us to do is to honor our health officer's order to provide non-congregate sheltering for purposes of isolation and quarantine and for individuals that are categorized as high risk with underlying health conditions amid the COVID-19 pandemic. So the lease agreement is for a lease payment to the city for the use of the entire facility for the exclusive use as a non-congregate shelter. And if you have any questions, I'd be happy to answer them.
Great, thanks. So Adrienne, it's my understanding that this lease is a FEMA reimbursable expense and that they're hoping to do an expedited payback compared to what they do for floods and fires, et cetera. Is that correct?
Best of intentions, that is correct. So what is typically the case during a presidential disaster declaration, which we are under, we're also under a state disaster declaration for COVID-19, is that emergency response measures are eligible for FEMA reimbursement at a 75% rate. In this case, the state has honored to pay the remaining 25%. So emergency response and protective measures borne by the county and or other forms of local government stand to have 100% of those costs reimbursed from either the federal government and the combination of the state. In terms of non-congregate sheltering, this is a new program and a new kind of category of emergency protective measures that has been authorized by FEMA amid kind of these just unique situations that have posed themselves with this pandemic. And so they are approving these plans in 30-day increments with the intention of being responsive to what the actual needs on the ground are and to whatever the public health emergency is, recognizing that it will be different across the country and even within certain states. And so we have to go through a process of having our plan approved every 30 days. We're currently operating under an approved plan that expires on the 10th of May that we have every expectation, and in our conversations with the state and FEMA, that we will get approved for a second operational period beginning on May 10th. And the purpose of these 30-day increments, as I said, is to be very responsive to what the needs are in that moment in time. But it also, they're rolling out a new mechanism of kind of paying as you go, recognizing that local governments are expending a tremendous amount of money in response to COVID-19. So we will be submitting those costs through the FEMA portal in those 30-day increments with the expectation that we would see reimbursement much sooner than we have in other disasters such as fires or floods, where typically those reimbursements take 18 to 24 months to recoup.
Great, thank you.
Adrienne, so my understanding is the City Council approved this last night. If we were to approve the MOU today, what will the next steps look like for Sleepy Inn?
Sure. So for the last week, City Council last week approved the details, and we've been working with the then owner to get into the site to take a look at what needed to be done to make the facility suitable for non-congregate sheltering use. And so once that happened and the city actually took ownership of the facility yesterday at 1 p.m., we have begun work starting this morning to start making those remediation, mitigation, and repairs, making it suitable for use. That will continue until we get to the point where we actually are able to have it suitable for occupancy. We anticipate that we would be able to do that potentially as early as late this week, but we're aiming for early next week. We've run into just some issues with some of the labor force that we were planning to use to pull carpet and those kinds of things, but we're rapidly working on a plan B. So this lease agreement essentially allows us to have exclusive use of the facility for our purposes of non-congregate sheltering.
Thanks.
And then maybe can you talk about liability or shared, or the joint shared liability with the city and the county?
If Anna Connolly is on the phone, I would probably defer to the lawyer to talk through that, but the intention is that we have both city and county staff that will be making decisions jointly around the operations of the Sleepy Inn, so that we're sharing that liability with both a city-owned facility and a county-run operation.
Great.
Yeah, this is Anna. My understanding is that we're in the process of purchasing an insurance policy to cover some aspects of operation. And I'm not sure, I don't think we've finalized the policy that we're purchasing yet. I don't know if, Erica, you want to weigh in on that?
Sure. So this is Erica Grindy, Director of Risk Management and Benefits. We received, both the city and county received a draft of the general liability policy that will cover the activities at this location. The policy will be issued to Missoula County with the city of Missoula as a named additional insured. I'm in the process of reviewing that, and we're also finalizing the quote as the insurer had requested some additional information late last week. So we should have a finalized quote, I would imagine, hopefully today or tomorrow, as I understand it. And Adrian can speak to this, but it's also my understanding that we will not have anyone in this facility until next week. And so we should have insurance in place well before we start using the facility.
Great, thanks.
Yeah, I'll just chime in. I'm supportive of this action. One of the prime responsibilities of the Board of County Commissioners and local government is to further and protect public safety and health. And this falls exactly in line with that, and particularly in terms of addressing the needs of isolation and quarantine for folks who have no other home. It's a little bit ironic in that some of the criticism I've heard leveled at local government recently, and that would be the city and the county, is that we are moving too quickly, when usually the charge against us is that we're moving at a glacial pace in local government. So I think this bespeaks the level of importance of this issue, the acuteness of the crisis that's before us and that we're wrangling. And so I look forward to getting this MOU in place and putting this facility to use.
Was that a motion?
Motion?
I move that we adopt the MOU.
Nice, great.
Okay. I agree. Second.
All right, all in favor?
Aye.
Aye.
So it's done. Thank you, Adrian, for all the work and all the people that work with you to get this.
Commissioners, this is Anna. You may want to take some public comment on this item before you vote.
Oh, thank you.
Is any public comment out there?
Clearly, Chair Slotnick was able to intuit no one was wanting to comment.
I got lucky on my intuiting on that one. Any of the media folks have any questions?
Can I make a staff comment?
For sure.
It's so hard to tell if the media was poised to ask a question. I'm sorry, but I just want to extend my thanks from our whole team for this support. I think it's been a very difficult move, but we've had people using what we've been able to provide for them all along, and that continued through the last week when we discussed it with City Council, through the weekend till today. I'd want to point out that with the Centers for Disease Control updating the symptoms, the COVID symptom list from 3 symptoms now to 9, and us opening our testing for those other different symptoms, I expect that we will have more people just using it, at least for the, to get through the screening for the tests that wouldn't have made it through the screening before. And so to have a place to put folks, a good place that's clean on a moment's notice and protects others, is just essential. And I appreciate everything it's taken to get to that point. Thank you.
Thank you.
So, Martin or Shannon, do you have anything you want to know about this?
I don't have any questions. Thank you.
Great.
Yeah, none, thanks.
Okay.
This is Anna again. Sorry, Josh. Did the commissioner's office receive much comment leading up to this meeting?
No.
No.
Annie?
Yeah, Annie or
Emmy?
Annie?
I did not receive anything. Sarah Bell, I'm not sure if you received anything.
We did.
Can you hear me?
Yeah.
Yeah.
No, there was very little comment about this hotel specifically.
We did, Anna, to answer your question, the only comment that I recall receiving is some public comment maybe a couple weeks ago when in the midst of the city council debating purchasing the Sleepy Inn, there was some concerns articulated to us about the condition of the facility and health department inspections that could lead to a determination that this is not fit to live in. But I certainly think the City County Health Department has adequately addressed those concerns, how those will be mitigated.
Great, thank you.
Yeah, all I can add to this is that this was a great act of creativity and people acting quickly. Everyone from the city council and the mayor and MRA to Adrienne and her folks, to our lawyers, everybody trying to figure out how we get from point A through problem solving to point B, where right now we actually have a place to put people who are unsheltered and who are experiencing symptoms or otherwise waiting for results, or who are over 65 and in a vulnerable group. And it's the best thing we could do in terms of public health to keep these folks out of the general population. And this allows us to do that. So I'm glad we're doing it. All right, I think we beat that dead horse. Larry, you're up next, unless there's somebody. Yeah.
This is Vicki. I just want to let Annie know that the MOU you have, we will get the original from the city. I don't know if you've received that yet. And that's the one the commissioners will need to sign.
I haven't yet, but I'll keep my eye out for it.
Thank you.
Okay, going once, going twice. Okay, Larry, you're up.
Thank you.
Good morning.
Thanks,
I've
Alan.
got a change order. Hi, how you guys doing?
Okay.
I've got a change order for the library project, change order number 8. There are 6 items on there. Only a small part of this is out of the construction contingency. The rest is owner changes that Honora has asked for. Some of them deal with what you see when you look at the building on the inside. One of the change orders was to paint some insulation. For whatever reason, when you get in the building, you could see it and it didn't look real nice. So they're going to paint that and kind of hide it. PCO 38 was some casework changes, and it was missed in the bid item. It was it was added back in. PCO 45 was an adult that was bid, but wasn't accepted early on because we were trying to get within budget, and now there's enough money to cover that. PCO 46 is some painting above the ceiling, kind of a hard lid that again was another one of those items that was visible, and by painting it looks like it's finished instead of kind of rough. PCO 47, we had some double mirrored kind of glass. They decided if you were having a meeting in that office and you wanted it to be a little more private, they wanted some shades on it. So that's one that was added back in. PCO 49 is the fireproofing that was painted. PCO 50 was an upgrade from a residential type range to more of a commercial range. And this was a request again by the library early on. It was cut back to get into budget. Now it's added back in, and that's coming out of the construction contingency. Yesterday, Ann Hughes and I went through kind of a hop, skip, and a jump, looking at contingencies and what's been spent, and so far with a 1% construction contingency, we haven't had anything major come up that's kind of blown that out of the water. So at this point, everything looks like we're doing fine. There's money in the budget to pay for this. So this is change order number 8. There will be another change order number 9 in a week or so, just for small items that we're picking up as this gets finished up. So if you got any questions, fire away.
Larry, how long is the job going to continue now with the library? What's the estimated completion date, given everything that's gone on with COVID?
They're looking for occupancy in mid-August. There's several things that have been delayed because of the transportation and factory shutting down because of viruses that are kind of holding it up. Honor wanted to open up a month earlier than that. So far, it looks like the shipping dates are going to make it so we can think mid-August for an opening. You know, I think as this thing loosens up a little bit, we'll be able to get back on track. Time-wise, it actually, I think, is kind of a good thing because it gives the contractors time to finish things up without being rushed. It gives the library time to start stocking books into the areas that they're going to have finished before that. So I think it's going pretty good. Contractors are all working. They're following pretty much the same safety things that we are, with masks and temperature checks and signing in that they haven't been sick before they go on the job. So Dick Anderson's doing a good job. I've been impressed with the work that they've done.
Hey Larry, this is Erica, and you may have just shared an exact date or as close as you know, but for insurance purposes, I have this coming on as being a finished project starting July 1. Should I push that finalized date back?
Let me get a hold of you tomorrow after the owner construction architects meeting. I'll ask that question and see if I can get you an actual date.
That'd be great, because as you know, then I also need to potentially extend the builder's risk policy. So I just need to know where this falls.
Right. Yeah, I think you're gonna have to do both those things, Eric. It just depends on the date that they're planning for now. Now it sounds like 8/15, but.
Well, that's great, Andrew.
So Erica, I had a invoice for extending builder's risk last week that I sent in. Is that what you're asking about?
Well, so that extended it, I believe, through June. But we'll have to extend, if they're going to still be in construction in July, we'll need to extend that builder's risk again.
Okay, I'll find out for sure what their proposed occupancy date is and get back to you tomorrow afternoon.
Great. Sorry to take over admin meeting with our conversation.
Nope, that works. Any other questions?
No, I move that the board approve the change order number 8.
Second.
All right, all in favor?
Aye.
Aye. Thanks, Larry.
Thanks, Larry.
Thank you and stay safe.
You too.
All right, Kelly McGuire.
Good morning. So this is can you guys hear me?
Uh-huh.
Yeah.
Perfect. This is a contract amendment for a professional services agreement that we have with Strategic Prevention Services. And this was adopted in October for work that was meant to be done right about now. But unfortunately, due to COVID-19, they've been unable to do things like interviews or focus groups. They're based in Washington, so they probably shouldn't be traveling to Montana right now. So this amendment would extend that agreement until December of this year.
Kelly, can you remind me, Strategic Prevention Services?
Yeah, so this is a grant that we got from DPHHS for $25,000, and that grant was so that we could hire a contractor to work with us to do a community needs assessment around sexual violence prevention. Yeah, sorry I didn't give that background.
Thank you. I couldn't remember where it was. Okay.
Yeah, you have a lot to keep track of, so.
Thanks for asking that.
Yeah, so that's what this would be for. And so it's just kind of hard to do interviews and focus groups right now. And it's hard to say what things are going to look like the rest of this year, but for now, we'll extend it to December and kind of see if there's going to be an option to do that differently.
Great. Well, I would move that we approve the PSA.
I second.
All right, all in favor?
Aye.
Aye.
Thank you.
We're flexing with this crisis.
Thanks, Kelly.
We have no choice. Thanks, Kelly.
Thanks.
All right, has Emily Brock joined us?
Would look like.
There you are.
Am I on?
You are.
Sorry, I'm on two Zoom call or two Teams calls right now. So the Economic Task Force is meeting right now. I'm listening to actually Shannon Thrall and Linda McCarthy talk on another computer. So this item is a GMAX amendment in the amount of $154,384.73 to the AIA 133 contract with Jackson and A&E. And this project is associated with the big landscape historic plaza contract that we're doing right now. Originally, and the reason why we're doing a GMAX amendment and not just a change order is that this originally this piece was going to be part of the Mid-Century Buildings project. But what we decided when we got the cost estimates for that was to slow roll that and general that in-house. So Al and Monty will be generaling that and bidding that out in smaller pieces. But this one piece had to be done in conjunction with the Historic Plaza contract because it is all of the utilities that are going to be underneath all of the beautiful concrete that we're pouring. So this piece we want to do now through Jackson. So that is for the sewer, water, fire utilities that are going to be under the Historic Plaza and connect to the fair office and the floriculture building. And another piece there that's important to know is that all of the irrigation controls and lighting controls for the Historic Plaza will be in the fair office. So that work also has to happen now. Does that make sense?
Mm-hmm. I don't have any questions and want to keep this moving. So yeah. I move to request the board sign the GMAX amendment.
Second.
All right, all in favor?
Aye.
Aye. Thanks, Emily.
Thanks, Emily.
Yeah, go back to that other call. Tell them to solve the problem already.
All right.
Yeah.
Thanks. Vicky.
The next two items, commissioners, are amendments to resolutions you signed earlier I am about a month ago. The first one is to amend Evero Finley O'Keefe Community Council. There was a vacancy term that we needed to add to the resolution. So that is the only correction, I believe, to this vacancy term was to add that. And then the second item is Clinton Rural Fire District. The elections office missed that someone had filed a write-in declaration, Jared Wallace, W-A-L-L-I-S. And so I needed to amend that resolution so that he gets elected by acclamation and we cancel that election.
All right.
Okay, I would move items 5 and 6.
Second.
All right. All in favor?
Aye.
Great. Thank you.
Thank you.
Do we have any correspondence? Okay, seeing none, we'll jump to discussion items. The first thing up is the Election Center update.
Yeah, hey everyone. Just wanted to touch base with you guys on the Election Center. So we've been working with A&E in Jackson. We got drawings all put together, and Jackson came back with a rough estimate of the cost, and it came in at 1.8 million, which is currently we have financing for $1 million worth of renovations, so well in excess of what we're currently financed for. So that's kind of pushed us back to the drawing board on how to approach this project overall in terms of making it a feasible building for what we want it to be in terms of an election center, backup EOC, and also an extra training classroom and public meeting space potentially. We want to make sure it remains flexible and not cut out those main features of the building. So currently we're looking at proceeding as more of a phased plan and use this current financing to do what we can while leaving mechanical systems in place that will allow us to continue building out the building to meet all these requirements we'd like to see in the building. So currently we're going to focus on the north half of the building, which will be where the main voting area is. And this election, the county center will probably remain at the fairgrounds. We're focusing our energies on the north side because currently ICE is still operating in the south end of the building, and their lease doesn't expire till September, giving us little time to move in there. There's potential they could move out early, but it's unpredictable, especially in today. So depends on how quickly they sell ICE. So we're going to concentrate on the north half with our current financing, but wanted to update you guys, let you know that future financing might be necessary for a complete build out of this building.
So Casey, if we focus on the north half and keep it down to $1 million, what are some of the things we're going to be foregoing that we thought we were going to get?
Yeah, so for the first phase with the $1 million, where it's kind of what we're brainstorming through now is what we want to see happen. So what we're looking at doing is still we're going to put in pretty much a grid of floor electrical that will allow pretty much a lot of flexibility in the room, so you can do many different table configurations for classroom, voting, and that kind of thing. We're going to kind of cut back on the parking area, is the plan, but have the other half still gravel as a temporary parking lot. So we'll still have that space for parking, but it won't be necessarily fully paved with curb and gutter islands and all that, which is a large expense. So that could come later down the road. So we'll build out the bathrooms in the north end and pretty much try and meet those requirements for that building space. And then we'll probably also demo the freezer and have that space cleared out because we need to move mechanical systems kind of through that building because they'll be positioned on the south end.
So if I'm understanding right, the only big thing we're holding off on then is kind of making part of the parking lot as nice as we would like it to be?
So the parking lot, I mean, will be put off. The south building, well, obviously that won't be built out at all. That will just be pretty much an empty warehouse space still.
And we can live with that for a while.
Exactly. And ideally we can get that built out by the next election in 2022.
Okay.
One of the other things, if you guys remember the drawings, we had an addition on the north half to the side that was going to be a potential waiting area that will also be put on hold, where we are going to infill the loading dock and add a waiting area.
And with a modified scope of work here, would we then have to go out for bid again? Or?
It's my understanding, so it's still the same scope of work, it's just now being broken out into phases. And because we did the contract manager, the GCCM, we brought Jackson on to work with architects with the whole scope in mind. So it wasn't a design bid build. So it's still all within the scope of our current contracts with with Jackson and A&E.
Okay. So Casey, this is just a little bit side question. How do you like this model compared to the design bid build?
I think it's been great, especially for this project, just because there is a lot of different pieces going in, and we've been able to, if we had gotten bids in for 1.8 million, we would have had to scrap it and start all over with the design process. So having the contractor on to kind of work us through what we can cut out of the overall build to make things run smoother we found savings there, but then also, we've now can continue on with this process without starting the whole process over. So I think it's been really helpful.
That's great. We're kind of contemplating using that as a model on some of the Mullen project that's sort of Shane's advice. It's great to hear that you are appreciating this as a model as well.
So with the parking lot piece, is there, or has there been any discussion of whether there would be an opportunity to use our own public works folks to assist with that?
Yep. So we're working with, I just had a call with Shane and Steven, who's the contractor with Jackson, kind of figuring out how we can work public works into the system as much as possible in terms of what time capabilities they have to contribute to the project and how that fits into the overall scope, and so where they can work in. So Shane's been great in terms of offering their services and volunteering their time to help out with the election center. So we're going to work them in as much as we can to save costs there.
Good. Rumor has it they've done a great job out at the Historical Museum at Fort Missoula on their parking lot. So
yeah, I heard it was.
Does Andrew, do you have anything to add to this?
I think at first, let me congratulate Casey. He's done a fantastic job keeping all the different pieces of this puzzle moving forward. One of the concerns I had going into the project was the financing, and we had no idea what we were asking for when we asked the board to approve the purchase price of the property plus a certain amount of dollars to do the construction on the property, and we picked $1 million, and we negotiated that deal it was after the beginning of the fiscal year, but it was last year. It was with First Security Bank, and so we've got that interest rate locked in. We've got $1 million of capacity that we haven't spent. So this is really the only way we could go right now. We had to break it up into pieces. I think the $1 million being spent right now makes a lot of sense, and we can get most of what we need done. And then in a subsequent way, we'll be in a whole different world in 12 months from now. So that's what I'm hoping is what next fiscal year we'll be able to do the second half of the project.
Great, thanks.
Thanks, Casey.
Yeah, thanks guys, appreciate it.
I hear some birds tweeting there. Somebody must be outside.
I am outside.
No.
So anybody have anything to speak to in terms of upcoming board meetings, review of meetings, etc.?
Is it tomorrow night that we're doing our kind of public community council meeting, open house?
Is that tomorrow night?
Yes, it's tomorrow night at 6:30.
Great.
Thank you.
Yeah, thanks so much for setting that up.
Yeah.
You're welcome.
Is there any sense of, I guess, sort of RSVPing? Sarah, what do you think if you're gonna make a prediction on participation, do you have any sense?
We have about 4 people who have accepted the invitation. I just sent out a reminder this morning, so I've had 2 emails responding that they're excited for the meeting. But I'll send out another reminder tomorrow.
Good, thank you.
So besides the 3 commissioners, are there any other staff who will be participating with us?
Chet said he would participate, and he invited Andrew Hagmeyer. I don't know if Andrew will be able to make it. Do you want me to make sure that they're all on the line, or?
Yeah, it'd be great just so that we're like, it keep us legal and truthful and be able to like provide information. We're not just making stuff up.
Okay. So
I'll be on the call also, Commissioners.
As you are so prone to do, Juanita, just to make stuff up. So.
Do you want to send me a list of people that you specifically want on the call for staff?
Chris and Chet, is anyone else, Dave? Yeah, Andrew.
Yeah, I will be on tomorrow night.
Good.
In case there's anything I can do to be helpful, or
Yeah, I
sit
bet,
quietly and listen.
Chris, I bet you'll be Johnny on the spot to answer questions related to emergency services and things like that. That's a world you know pretty well, and I bet people will be asking questions about it.
Yeah, I thought it might be helpful just in case if there was something I could cover. I know there's lots of questions, especially as we work towards reopening. So
Yeah, there should be plenty of questions there. I believe
this
that.
is Ann. Did I just hear you say you wanted me to attend as well?
Sure.
Are you available?
I can be. Sure thing.
Thank you.
You bet.
Thanks, Ann.
The meeting will also be recorded. I'm
Great.
going to attend and record it. So.
And I believe the reopening working group is beginning soon. I'm not sure if that's today or Thursday. I can't remember, but I think that group is having their first meeting in the very near future.
their first meetings today, I believe.
Okay, great.
So, which collides with the strategic planning meeting. Josh, did you decide which one you wanted to attend? The strategic planning or the COVID reopening group?
Who's going to be at the strategic planning one?
Is that the Dan Clark?
Yeah, Dan Clark is joining this afternoon. So that's this afternoon and tomorrow with Dan Clark.
Oh, really? I didn't.
Well, yeah, I think I should join in on the Dan Clark one, and I'll jump in on the reopening group. I think their next one Thursday.
It is, yes.
Yep, I'll do that. Okay. It's a big group, and I imagine today is going to be just laying the groundwork.
So Josh, is the reopening group just an expanded version of your group that you've been meeting with at 9:30 in the mornings?
Pretty much, yep. And that's when you had questions about some community groups that wanted to be included, that's the group they wanted to be included in.
Okay.
Oh, thank you.
And we got them included.
Great.
So will the 9:30 group continue on as a separate thing, or are you just holding it together?
Right. We're the conversation we had this morning, we're going to meet again next 9:30 on Thursday just to do a little update. But my hunch is that it's going to segue into this reopening unless things turn heading backwards instead of forwards due to public health concerns, not to anything else.
Right. Okay. Well, glad you got that figured out.
Yeah, I will report back after Thursday and see where we're at.
Great.
Josh, could you send that bird over to my house? It's so cheerful.
I also have 2 border collies right here. It's quite a nice scene. And 1 daughter. I'm pretty much set. All right. Do we? Anybody want to speak to any other COVID things? Our last item.
Josh, I would just tell you that Ginny is working on your talking points for your video with the mayor today.
Great. All right. I will look for a note.
Yep, you'll be hearing from her on that.
Okay. Thank you for letting me know.
You bet.
This is just we have mattresses, right, for Sleepy Inn? Those have arrived, or what's our?
They arrived yesterday and the frames are coming in on Wednesday.
Awesome. Thank you.
Uh-huh.
Okay. Do we have anything else we should be chatting about? All right. Let's call this one done, and we'll all talk soon.
All right. Thank you.
Thank you all.
Thanks, everybody.
All right.
Thank you.
Thanks. Goodbye.